First session is about pharmacy careers, and we have my friend who I've known for a long time and done a lot of work with, Janet Dumonchelle. She is the pharmacist in charge of student health services at Sacramento State University, and she's brought along a few of her friends in pharmacy. And we also have a pharmacy student to talk about her story as well, and her name is Farah Sedki, and she'll be speaking after Janet.
Thank you, Lindsay. So I really appreciate having this opportunity to just tell you a little bit about pharmacy and my path. And I do this little presentation for their high school students that are discerning what they want to do in the future. And so it's called Everything That You Wanted to Know About Becoming a Pharmacist, but Were Afraid to Ask. In other words, I want to tell you why I love being a pharmacist. So, first of all, I'll tell you a little bit about my journey. So I am one of 8 siblings. And so I come from a very large family. I was the first in my family to get a college degree. And I'm the only one in my family that actually got a degree in healthcare. And so I had a lot of love and a lot of support from my family. And it was a long journey. I went to the University of Southern California. I am an LA girl, so I went there for my undergraduate degree and also for my graduate degree in pharmacy. But I have been a pharmacist for 35 years, and I love being a pharmacist. I tell students that if you find yourself going down a path and you're not really happy with it, or you're not really loving it, that it's okay to try to find where your passion is going to be, where you're going to find your happy place. So, for me, I had started off actually as being pre-med. I thought, I want to be a doctor. I want to go out and, practice medicine and cure people, save lives in that capacity. But then I got a job, working in a big medical center down in Los Angeles as a clerk. And, with that experience, it wasn't that, I thought medicine was too hard, or medicine, it was, blood and guts and yucky or anything like that. But it didn't seem like it was a good fit for me. And so I was really afraid, to tell my parents, because ever since I was in grammar school, with junior high and high school, I had been saying, I want to be a doctor. I want to be a doctor. And then all of a sudden it's like, I don't want to be a doctor. I want to find, I need to find something else that's going to, capture, be my happy place. That I'll be passionate about. And so I had the opportunity to meet with pharmacists that also worked in that medical center. And they were telling me about, what the pharmacy profession did. And so as they went through, their day in the life of a pharmacist, I went, that sounds like a better fit for me. And so I ended up pursuing my degree in pharmacy after that. So I just, again, encourage you that, to give, different things a chance. And, you may find you might be on one road, but, there might be something over here that just, captures you, and just, it's okay to explore it and see, if it's something that's a better fit for you. And, now being a parent, I have two sons that, their path has gone, kind of swirly, but I really, appreciate them having the conversation with me about, what their thoughts are, about their their paths, whether it's going to be in college and, what careers, and, just encouraging them to find, where their happiness and their passion is going to be. So, at the end, I'll, any other questions you might want to ask, I'll be happy, to go through those with you. So I love being a pharmacist. I am currently here at Sac State. I've been here for 20 years, and I just love having the opportunity to work with students who have never had the opportunity to go to the doctor without their parents. And so I'm sure all of you, have, gone to the doctor, and your mom or dad have gone with you, and they ask the questions to the doctor. They tell the doctor what's going on, and the doctor may ask you a few questions. But when you go to college and you do access healthcare, it's going to be you that is going to be asking the questions. So, and you telling the doctor directly, what's going on with you. And so, part of what I do here at Sac State is also to help students advocate for themselves when they are getting medications, to ask the questions about, what is this medicine for? What are the side effects? Is it going to interact with other medications? So that's part of the joy that I have here is being able to help students become better healthcare consumers, to ask questions. And with this knowledge, they can also help their families as well. So we'll go a little bit into what does a pharmacist do? So a big question. And when those pharmacists back in the day, when I was trying to figure out what I wanted to do with my life, they said, well, why don't you think about being a pharmacist? And I said, why would I want to be a pharmacist? Because all you do is count pills. And when I said that, I got a big no. There's a lot more than counting pills. So that is just a very, very, very small portion of what we do in this profession. So pharmacists, we are one of the most accessible healthcare providers. So what that means is you can walk into a Walgreens, a Rite Aid, a CVS, a Target, and if they have a pharmacy, you can walk up to the counter if you have a question and say, I have a question for the pharmacist. And so you don't have to make an appointment. You just, you might have to wait a couple of minutes if we're in the middle of, filling a prescription. But, pharmacists, I do this all the time. People come in and have questions. I'll ask them what their questions are, try to figure out what's going on with their health. If there's something that I can make a recommendation for medication, and if it's something that I really feel that they really need to see a doctor or a medical doctor, or to get a little bit more intervention, then I will say, there's nothing here that I could really sell to you to help you with your, what's going on. I really think it's very, very important that you see a medical doctor. And since I am in a clinic, I have the privilege of being able to walk that student over to either our urgent care or primary care and help them make an appointment to be seen, by a medical provider. So our advice is always free. So we don't charge, for giving, any of this, medical advice. And so we can also provide other services that over the years, I've been a pharmacist again for 35 years, that when I got out of school, our roles have greatly expanded over the years. And so, one of the ways that our profession has expanded is that, we can give immunizations. So we can give vaccines. Right now, I'm doing COVID vaccines, for people who would like to get vaccinated. I can give any other, routine vaccines, if needed. We can furnish, can we provide direct care? Yes. And so, we can also furnish other medications such as birth control, emergency contraception. We can help people with smoking cessation. We can also do naloxone, which is a reversal for opioid overdoses. We can furnish that, and we can also furnish travel medications. And as I mentioned, before, we can do immunizations, and we are currently, it's been, a privilege, for us to also be able to provide the COVID vaccine. And at our facility, we have given over 20,000, vaccines, of COVID vaccines, since they became available to the public. And so, pharmacists, we also, I put this picture up. It's a picture of one of our clinics, and we, we have 3 intern pharmacists. This is one of our flu clinics that we have in the student union here at Sac State, and you'll also see nursing students. And so, pharmacists are a big part of the healthcare team. And so you will see us collaborating with other healthcare providers to give service to our patients. And so a big push with medicine now is the team approach. Whereas before, you might see, oh, well, here's a doctor, here's your nurse, here's your pharmacist, here's your physical therapist. But now we all come together as a team and to discuss patient care, because we can all contribute a lot of good information and knowledge based on our expertise that, we can help provide for our patients so that they can recover better, or give them, put together a plan of care so that they can move forward to, attaining wellness. And, part of our charge here at Sac State in our clinic, in our pharmacy, in our health and wellness promotion is that we want students to be successful by being healthy. And so we want to be part of, their journey through college. It's keeping them healthy. So that's why we have this team approach, to make sure that, we're touching on every single, possible component. So I will go briefly into how do you become a pharmacist, because also my intern, she's going to go through, a little bit of that as well. So, pharmacy, if, after, you're going to get a lot of really good interactions with different healthcare professionals with this seminar that you're participating in. You're going to there's going to be behavioral health, there's going to be, MDs, you're going to be hearing from different health, care professionals and their career paths. And so if there's something that actually captures you that you think, I think I want to write about, being a, physical therapist or a counselor or a pharmacist, start asking the questions, start, there's going to be, I'll have my contact information at the end of this presentation, and the students are going to have their contact information, email us, if you want to, find out something about pharmacy, I'll come down to Sac State. I'm happy to talk to people about, my experience working as a pharmacist, because, I not only have worked here at Sac State, but I've also worked in other settings. I've worked a little as an intern. I was in a hospital. I started off working in a clinic similar to Kaiser, back in the day. So I worked inside a HMO, they call them HMO clinic. I did that for several years. And I also worked in home health and home infusion. So, I've worked in different practice settings, and they have all been really amazing experiences. And so if you're thinking about any healthcare career, find a healthcare professional to talk to, and they will be happy, to share their experience, and they can also let you know a little bit about each of their practice settings and what they loved about each of their settings. So just in brief, to become a pharmacist, when you're in college, you're going to take certain courses. You do not have to have a degree in science. I was a psych major, so I had my degree in psychology, and I also had master level work in counseling. So I was this close to getting my degree in counseling when I was accepted into pharmacy school. So that's, one of the things that's maybe on my bucket list, that I might go back and actually get my degree, my counseling degree. But everything that I learned while I was taking master classes in counseling have been very beneficial to me in my practice of pharmacy. So you don't necessarily have to have a biology degree. You don't have to have chemistry degree. I had one intern pharmacist who had her degree in fashion. I kid you not. She had her bachelor's in fashion design, and she got into pharmacy school and is now a pharmacist. So, if you find something that you just need to take the required courses and do well in those courses when you are applying to pharmacy school, and they also want to see that you are a well-rounded person. And that's not just for pharmacy. If you're going to go to medical school, it's good to be smart and good to be, a bookworm, or, apply yourself to your studies. But they want to see that you're more than a person that's like this, always, in a book. They want to see that you also are part of your community. So you want to volunteer, volunteer in your church. I had, one student that she used to teach ethnic dance at one of her parks, local parks. And so, that was one of the things that she really loved, doing was, she was from India, and she taught, certain traditional dances, to kids in her community. And so, there's so many things that, that you might like to do, that it's always good to build up, I'll say, your resume, or, you can just, or things that you can add on to your application. So seriously think, about things that you love to do, in addition to your academics, because that can help make your application to whatever professional school kind of stand out. Because when I saw somebody that said fashion design, they probably went, what? Fashion design degree? I want to talk to her and find out what kind of person she is, and why she's going to make a good pharmacist. And so they thought that she was a good fit. And so they did, get her into pharmacy school. And so for pharmacy school, and that's me 35 years ago with one of my colleagues, you get a doctorate. So after successfully completing pharmacy school, you do earn a Doctor of Pharmacy degree. And you're also able to specialize in different areas of pharmacy as well. And so a little bit about work in a pharmacist practice. Well, the sky's the limit. We can have you practice in an academic setting. You can be a community pharmacist like CVS, Walgreens, compounding pharmacist, pharmacists, compounding is like cooking, and that's one of the most favorite things that, a part of, what I learned while in pharmacy school was how to make, medications that just aren't made by a big drug company. Sometimes you have to kind of get old school and mix things from, the basis. And, if you think about pharmacy and the roots of pharmacy, hundreds and thousands of years ago, pharmacists were medicine men, medicine women, curanderas, curanderos, they had different names in different cultures, but they were like the foundation of what pharmacists are today, because they use plants, animals, herbs, different components to help heal, their village, their tribe, their people. And so pharmacies have been around for a long time. So just a little side note, but you can see pharmacists have a lot of areas that you can practice. And so, Lindsay, do you think we have time to show? I have a 2-minute video. Yes, no.
Yeah, I'd go ahead and show it.
Okay.
Yeah, you can show it. I mean, while you're dialing it up, there was a question in the chat. If you'd like to answer it, I'll read it to you real quick.
Sure.
Do you think it's harder to be a pharmacist than being a nurse?
I'm not going to say it's harder. I'm going to say it's different. Yeah. I worked like this with nurses, right now, and what they have to do, I didn't have to do a lot with anatomy. We took like a semester of anatomy, and, with nursing, it was a lot more intense anatomy, things that they actually work with cadavers and things like that. So I'll have to say it's different, but I'm not going to say it's.
That's what I was thinking. It's definitely different, and it just depends on what you like.
Right.
I have another couple questions for you. Out of all the jobs in the medical field, does pharmacy require the most knowledge in providing medicine and the overall patterns of the patient's health? Also, which specialized occupation does your work overlap with the most?
Okay, well, okay, so let me see. The question about, say that again,
Does being a pharmacist require the most knowledge, overall knowledge in providing medicine and the overall pattern of the patient's health?
Okay, excellent. Okay, the pattern. Okay, thank you. All right, I'm sorry, I wrote it down, so now I remember. Okay, so in terms of medicine, okay, it's like a specialty. With pharmacy, we do 4 years. We study medicine for 4 years, and how it goes to the body, how the body metabolizes it, how it utilizes it. We know, we learn about the side effects. For medical doctors, they have maybe 1 semester or 1 year of studying studying medications. Nursing, they may have 1 semester of studying medication. So because this is my specialty, we are medication specialists. Yes, definitely. I do collaborate with a lot of our medical doctors and nurses. They'll come to me with questions about, certain medications that they're not familiar with. And then also, if I have a student that has, an issue, a medical, something going on, medically, and I'm trying to figure out a good, recommendation, I also go to them because, that's their specialty is, how, also, with certain disease states. So, we get a little touch. I think every medical profession, medical doctors get, a small bit of pharmacology, but a big part of therapeutics. Pharmacists, get a big part of medicine. Of medication, pharmacology, a medium size of therapeutics, but a little bit of diagnostics, nurse, so every profession, they have it's like a, pie, we have different, pieces of the pie, and our pie is different, of, where our specialty is. And so did I answer all the question on that?
I think that there's a few others, but I'm going to save them for other parts of this session.
Okay.
So go ahead and show your video.
Oh, okay. And so this is just a fun little video.
Pharmacy teams make a positive impact on people's lives every day. And
it's not showing.
Okay.
Oh, look, a beautiful, bouncy baby girl.
Okay.
However, even healthy babies sometimes
Okay, I love
a bit, and that's where a trip to the pharmacy.
So then let's just move on. Okay.
That's easier.
I'll send it later. So I can send it later, but you know, so anyway, but we can move on to our next section. But I will send that to you, Lindsay, and then you could, if you can, you know, share it with them. It's just a little fun thing, okay? And so now I'd like to move to, you know, with every profession, you know, we have our support, and you know, without this support, you know, we couldn't actually, you know, do our day-to-day job. And a very important component of this, you know, of our profession are, you know, pharmacy technicians. And so pharmacy technicians, you know, they're really the backbone of the pharmacy. You know, they help, you know, keep us on track with our task. They are able to, you know, they coordinate in the background, you know, filling prescriptions for us that, you know, we have to actually review and verify. But it helps me if I have a technician, if I'm talking to a patient and trying to give them advice, and you're coming to the pharmacy and there's a line of people in the pharmacy, the technician, you know, can get things started for me in the background. They can help, you know, and there's so many things that the technicians do that are so valuable. They help with inventory management, customer service, inputting prescriptions, and, you know, especially in an outpatient setting, it's just, I can't put a price tag on how valuable, you know, pharmacy technicians are. And so, you know, this is a path in the pharmacy world that, you know, you may want to consider, you know, as well. And, you know, I'll have Marissa Kumar. She started here at Sac State. She also got her pharmacy technician license while she was here at Sac State in her certification. And she actually worked for me for a while as a pharmacy tech. And now she's also an intern pharmacist and a doctor of pharmacy candidate. So well, I'll let you, Marissa, talk a little bit about, you know, your journey and what being a pharmacy technician meant to you.
Alrighty, thank you for the introduction, Janet. Are you guys able to hear me okay?
Yes, it's great.
Okay, okay, perfect. Okay, so my name is Marissa Kumar. I am currently a fourth-year pharmacy student at California Northstate University. As Janet said, I used to be her student. I just want to give you guys a little bit of background about myself. Initially, when I went and started undergrad, I thought I was like on a completely different path. All throughout high school, I thought I wanted to become an orthodontist. I had my heart set on going to my dream school. I did not get into my dream school, but I was like, it's okay, I'll take a longer path. I went to Sac State, and within my first year, that's kind of when my eyes opened and I realized, like, you know, maybe becoming an orthodontist isn't what I want to do. I started taking some core science classes, and like I was questioning, you know, like how far do I really want to go in school and what do I truly want to do? And that's when I realized, you know, being an orthodontist isn't exactly what I want to do. So I talked to a career counselor at Sac State, and they told me, you know, maybe I should look into becoming like a pharmacy technician or a dental hygienist, since I feel like being an orthodontist might be too much for me. And that did stick with me for a little bit, because they kind of did tell me to, like, you know, maybe Sac State's just not where I should be. I started looking into like how to become a pharmacy technician and how to like get exposed to pharmacy, just because I didn't know where to begin. So one of the first steps I took was becoming a volunteer at Sacramento, where I was able to volunteer in their inpatient pharmacy. And that was my first exposure to pharmacy. The technicians there like guided me like how to get my license to start working in a retail pharmacy. So I took their word. For me, inpatient hospital isn't my favorite bit of pharmacy. I would definitely say outpatient pharmacy is where I see myself and where I truly want to be. Um, Once I became a licensed pharmacy technician, it took me a little bit of time to get a job, but I landed my first technician job at Rite Aid and I started working there. And on my first day, it's when I realized like I truly want to go into pharmacy and I don't think I want to just stop at being a pharmacy tech. I truly appreciate how much work you have to do to as a pharmacy technician. You're filling prescriptions, you're billing insurance, you're solving insurance issues, you're helping customers that are in need, all while backing up the pharmacist as they're helping patients. And now that I'm at the intern level, just everybody who's in the pharmacy, like I appreciate from the clerk to the technicians to the pharmacist to even the store manager, because like it all goes hand in hand. Working at Rite Aid, I saw our pharmacist give a consultation to a patient, and in that moment, that's when I realized like, I want to be a pharmacist. That's what I want to do. I want to be the one who's helping patients as much as I can. So I worked at Rite Aid for about 6 months and I was close to finishing up my degree at Sac State. I, similar to Janet, I graduated with my bachelor's in psychology. I did not get my degree in one of the sciences. I just completed all the prereqs and earned my bachelor's in psychology. As I was close to the end, that's when I started to work for Janet as I was finishing up and just trying to do really well in school and just get through the application process. And I applied and I got into California Northstate. Spent my time there for 4 years. On my last year doing my final round of rotations before I get to graduate in a year from now. And I honestly can't say that I probably looked back at being an orthodontist like recently these past 2 weeks because I was talking to Janet about how I decided to become a pharmacist. But I just want to let you guys know, keep an open mind. Like you may have, your goal set on one career path, but as you start working towards it, really, if you feel like it's not the right path, like really think about it. Take some time to talk to people and get yourself exposed to see, are you on the right career path? Like, are you truly happy? Because one of my biggest things is like my parents didn't have the opportunity to go to school and they gave me, they left the door open and said, go become what you want to become. And, at the end of the day, it's like, don't be upset if you're not happy with your career because we let you choose it. So, be happy with the decisions you make. Don't feel like there's a rush to get done with school. Expose yourself to as many fields as you can because you, at the end of the day, you want to be happy working whatever position it may be, whether it's in the medical field or, maybe you are going to be the fashion designer because I could use a fashion designer in my future. Alrighty. And that's about everything I have.
Marissa, real quick, we have a question for you. Did staying in touch with your mentor make a difference in your journey?
Yes. So I would look at Janet as one of my mentors. I've worked with her back in 2017, and I go back and I visit Janet all of the time. I also have other mentors as well who I'm constantly in touch with. I think having a good support system is what gets you through to your end goal. So it is important to have, a good support system, whether it's your mentor, your friends, your family, just, your close loved ones.
Great, thank you, Marissa. And we have some other questions, but we'll save that for the other pharmacy students that we have coming on because I know you have somewhere to go.
Okay, thank you. Thank you for having me.
Janet, if you're talking, you're on mute.
I know, that's why I was talking to myself going, oh, I need to unmute myself. Okay, and so I'm going to, in a moment, let me see where we, okay, we go. Oh, okay, so now I'm going to, in a moment, stop screen sharing so that my other presenter can bring up her presentation. Oops, back. There we go. So I'd like to introduce Farah Sedki. She is an intern pharmacist, and intern pharmacists are the next generation because, you know, I'm 35 years into this profession, and I'm going to be retiring someday. And so, you know, we need a lot of, you know, amazing, competent, you know, pharmacists to kind of take up, you know, our, you know, kind of, you know, to fill in for us and, you know, kind of take the baton and pass, you know, move it forward. And so this is a picture of 3 interns from California Northstate wearing their mask appropriately as they take this picture. And so, you know, Farah, I am going to stop sharing my screen. And then I will, hopefully you can get your presentation up. There we go.
Perfect. Same. You guys,
Sarah, are you talking? Oh, there you are. Okay.
perfect. You guys can see my screen?
Yes.
Perfect. Okay. So I'm just going to be discussing. So, like Janet said, I am an intern pharmacist, and I actually also attend California Northstate College of Pharmacy in Elk Grove. And I'm just going to kind of discuss like the background of like what inspired me to become pharmacist, what inspired me to enter pharmacy school, and kind of just the requirements for different pharmacy schools and such. So a little background on myself. I attended my undergraduate career at Wayne State University in Detroit, Michigan, and moved around 3 years ago where I attended the College of Pharmacy at California Northstate. And just a little brief background on what inspired me to actually attend pharmacy school was during my undergraduate career, I job shadowed a pharmacist on my campus at a pharmacy. And I just really enjoyed, like Janet was discussing, how accessible the pharmacists are to their patient. So I both volunteered at a hospital and a pharmacy, and I just saw the different patient interactions that the pharmacist would have every day, and almost like a friend relationship where the patient can just walk in the pharmacy, just ask a quick question, just so they can get all their health issues relieved, versus, well, when you go to a doctor, you kind of have to make an appointment. It's a little more difficult. So I just really enjoyed how accessible the pharmacist was to all their patients. So that's a little brief background of what actually inspired me to attend pharmacy school in the first place. And also my dad was actually a pharmacist as well. So that kind of helped push me a little bit and kind of built a more fond relationship I had with pharmacy. So a little bit about my school. So CNU COP is a 4-year program, and there is 3 years of didactic learning and then 1 year of rotations. So I just finished my 2nd year, so I have 1 more year of didactic learning, and then the last year is rotations, where you kind of switch through different fields of pharmacy. You can go to a hospital, you can go to industry, and there's different fields of pharmacy where you kind of explore during those rotations, so you can kind of decide in the future what you want to do. And a little unique thing about CNU is it's based on team-based learning. So this team-based learning is really unique because you kind of work, so you're all set into teams throughout the semester. And how it works is the format is you learn everything. So you learn, there's reading before every lecture. And then once you attend lecture, there's something called an IRAT. So an IRAT stands for Individual Readiness Assurance Test. And that kind of tests all what you've learned at home. And then you get together in your team for the same exact questions, which is called a TRAT. So Team Readiness Assurance Test. And that's when you kind of work in your team, discuss what answers that you've already answered, and kind of helps you get used to that healthcare team, because again, in healthcare, it all depends on that healthcare team. You get to work with physicians, you get to work with nurses, you get to work with other pharmacists. So it kind of just introduces you to that team-based learning. And then CNU also has 5 main core values, which includes professionalism, innovation, inspiration, diversity, and communication. So definitely a wonderful school. So the pharmacy school requirements. So again, you're not required to earn a bachelor's degree in order to apply to most pharmacy schools. So that's actually what I did. So I'm a little different than Marissa said. She had a psychology degree. So I actually did my pharmacy prerequisites in 2 years and then entered pharmacy school right away. So you're required at least 2 years of undergraduate study where you'll complete the pharmacy prerequisites. And then once you are done with your prerequisites, you just send them over to a pharmacy school. They'll check your grades, all your different experiences. And again, it's really good to be different. So it's really good to have some cool hobbies, volunteer in the community. So one of my main hobbies was actually gymnastics and dance. So throughout my whole life, I've been really into both. And then I coached gymnastics for a little. So I really made sure to include that in my resume and my application. So it's really good to show the pharmacy school that you're different and you have more than just good grades. So some of the general pharmacy school prerequisites, Janet already kind of mentioned, you need a general and organic chemistry, both with lab, biology and physiology, microbiology, physics, biochem, and then of course the general education courses. So this is for everyone. So econ, statistics, calculus, public speaking, and a social science. So again, every pharmacy school has different requirements, but these are the general requirements for most pharmacy schools. And then there is a required examination, or it used to be required by most schools. However, not all schools require this anymore. California Northstate actually does not require this. So this is the Pharmacy College Admission Test, which is the PCAT. So again, you really want to do your research to make sure you find out which schools require which examinations and which courses. So the application process for pharmacy schools, most pharmacy schools use a portal called PharmCast, which stands for Pharmacy College Application Service, and it's designed for first-year professional PharmD programs. So this is a centralized application service to apply to multiple programs offered by schools and colleges of pharmacy. So it's a pretty friendly portal system, because what you do is you set up your application and then you continue to add programs that you want to apply to. So I personally applied to 3 different schools, all in the California area. I did one in Michigan, but then I ended up moving to California. And it's pretty nice and easy, because you just have to do one application and then add your programs. You do want to make sure that you want to make sure you look at the requirements for each different program, because it might have a couple more different requirements. So you do want to just make sure you check all your requirements, and then at the end you just submit your application, and then PharmCast sends it to all your different programs that you apply to. So it's a pretty nice and simple way to apply to different programs. So very common question is, how long is pharmacy school? So most pharmacy schools are 4 academic years. So my school is 4 years. There are some accelerated programs that are 3 academic years. So this is an example of this is University of Pacific, which is in Stockton. So they're 3 years instead of 4 years. And the PharmD degree is required to take the exam called NAPLEX, which stands for North American Pharmacist Licensure Examination. So this is the one component of the licensure process that's required in the United States to practice as a pharmacist. Now there's something called the CPJE, which is only in California, and it's the exam that pharmacists need to pass in order to practice pharmacy in California. So each state has different requirements and different required examinations. So it kind of just depends on the state you're living in and the state you're going to practice in. So after you earn your PharmD degree, you pass your state licensure examinations, then the College of Pharmacy graduates can practice pharmacy anywhere in the country. And then after your 4 or 3 years, once you graduate, there is an optional residency. So this is a PGY1. So this stands for Postgraduate Year 1 Pharmacy Residency. And it's usually around a 12-month postgraduate curriculum that offers training opportunities in acute care, ambulatory care, drug information, and clinical services. So again, this is optional versus like for in medical school, for example, there is a required residency, of course. This is an optional residency where you can specialize in different areas of pharmacy. And this is actually hopefully what I want to do after my 4 years. So I do definitely want to try to apply it to this optional residency. So pharmacy school life and organizations. So what I love about my school is that it offers so many different organizations, and it really helps you kind of make connections, make new friends, kind of talk to people that are in the same boat as you, because that's how you're going to get by all those years of studying and all those years of kind of just being around the same people. So you gotta make connections. You gotta kind of just make new friends. So I have here most of the organizations stated. The ones in red are the ones I'm actually a part of. So you have Student College of Clinical Pharmacy. This one really focuses on pharmacists in the hospital setting. So, and I'm actually vice president of this club. And there's Industry Pharmacist Organization. This one really focuses on industry pharmacists. So this one's also a pretty interesting one. I try to be a part of different fields of pharmacy just so I can see which one I'm most interested in. Then there's American College of Clinical Pharmacy, and I am secretary of that one. And then one of the really common ones is American Pharmacists Association. And then there's a couple pharmacy fraternities and sororities, and I am a part of Rho Chi. So that's that one. And what does the future look like for me? So I am actually interested in a clinical pharmacy. So I do really want to work in a hospital setting. And the roles of a clinical pharmacist include to provide critical input on medication use and dosing, work with patients to solve problems with their medications and improve adherence, and you consult with primary care team members about medication-related issues. I'm a type of person who really likes to solve problems and kind of just like new issues every day. So I feel like clinical pharmacy is like definitely the route for me. I like to kind of like work with medication dosings and see how I can change the dosing based on a patient and their different disease states. So I definitely want to go into this field more. And I actually just finished a rotation in a hospital called Orchard Hospital in Gridley. So kind of like introduced me to what a different a clinical pharmacist does in the hospital every day. And I've also done a rotation in retail pharmacy. So it's nice to kind of compare the different roles of a pharmacist has. There's several different fields of pharmacy. So something I didn't know in undergrad is I always thought a pharmacist is a retail pharmacist. So it's just a pharmacist I see in Walgreens or Rite Aid. There's definitely many, many different fields. And I really encourage you to kind of do your research on what are the different fields, what you could be more interested in, depending on your strengths and weaknesses. So that's a little bit of my story. And I do have my contact information here. If you guys have any questions or anything, I have my email. You guys can always email me, or I can always answer questions that you guys have in the chat or anything like that.
That's great. Thank you so much, Farah. And we'll send your information out to those that attended today. So we asked Janet some questions, so now it's your turn. I'm going to combine a few of the questions from the chat into one. So Farah, can you tell us what is the biggest challenge you have faced in your journey? And maybe share very briefly again, what does a typical day for you look like?
Right. So those are good questions. So typical day or week for me. So when I am going to school or classes, so it's a little, so in the beginning, I actually was working at a local pharmacy. I had a little bit of trouble kind of balancing both working and studying. So I did kind of step down a little and would only work on like 1 day a week. Like, so it would be like Saturdays or something. And I really focused on my studies, and that really helped because we all know that in the future that we'll hopefully be working. So I kind of just really focused on my studies, my exams, and it really helped me because I ended up doing really well in my first semester. So I kind of kept it up. So typical day, I go to class. So I commute actually. I live in Roseville and I commute to Sacramento. This is before COVID, of course. So the commute's around like 45 minutes. So I would drive a little early, try to finish some studying there. My day is usually from around 9 to around 4. So then there's some labs. So we have, it's usually Monday through Thursday. We usually get Fridays off. Fridays are usually set aside for exam days. So I'll just go study, do all my classes there, and then drive back home. I still try to keep up with some hobbies. So try to keep up with some gymnastics, dance. I try to work out just to kind of, de-stress and everything. And then I study at night. It's definitely try to keep, I definitely try to keep some time for family and just to enjoy my time. But yeah, studying, working out, that's pretty much my day. And then my biggest, what was the other question? Biggest challenge, right? That was the other question.
Yes. What has been your biggest challenge so far?
So definitely my move from Michigan to California. That was a big transition for me, especially because I was kind of thrown into pharmacy school right away. So I remember I moved a day before my pharmacy school interview. So I kind of landed to California, drove to my pharmacy school interview right away. So that was definitely my biggest challenge, but I kind of really focused on kind of just stepping out of my bubble. That's when I kind of made sure that I was a part of a lot of organizations, so I can get introduced to new people, kind of find myself in this new state. And that really helped because the organizations is full of people that kind of don't really know what they want to do. They want to kind of meet new people, get new ideas. So that really helped me, is just to be part of organizations. I started tutoring as well. So it kind of helped me. It's a nice way to help me learn and memorize things, was to actually teach. So tutoring really helped me as well. And it kind of just transitioned me really well. So that was definitely good.
Great, thank you, Farah. So Janet, we're out of time for questions. I'm going to turn it back over to you. Guys, get your ingredients out so that you can make your compound experiment with Janet.
Okay, and so we're going to compound like a pharmacist. I have Rita Salam. She is an intern pharmacist from California Northstate, and so I'm going to be like the movies, or that we're going to move the camera. There she is.
Janet, can you turn off your share screen so that we can see
yes.
the large screen? Thank you.
Yes. Stop share quick. There we go. All right. There she is. Say hi, Rita. Hi. Okay. Hi. And so we're getting a little short on time. So we're going to make a stress relief cream that you can rub into your onto your hands or on your wrist. And so go ahead, Rita, go for it.
Okay, so you guys should all already have your little recipe. So for the sake of time, I've already taped down my paper and laid the cream out onto the paper. So all we're going to do is put about 8 drops of the oil in the middle of the cream. It's a little more than 8 drops, but and then we're just going to incorporate the 2 different things together. You want to mix it pretty well. And then once it's all mixed, you're gonna put it back into the jar using the popsicle stick. And then you should all have a little label. So and you guys can label your little containers.
So Janet, I have a question for you while she's doing that. Can you, what type of specialty mostly uses compound medications? Who prescribes that the most?
Well, we get a lot of dermatologists. We get a lot of special, creams and ointments for different, special conditions that, people have. Right now, we also, with cancer patients, there's different chemotherapies. And so, they'll put together, since cancer for every person is so personal, so unique, that, sometimes they will, put together, different, types of formulas, for them. And then, like for pet meds or meds for children that, maybe don't come in, like say as a kid, who liked to take medicine? I didn't. And so, it can also be, compounding a medication, a certain capsule into a really nicely flavored syrup, so that it's taking the medicine, it's not as, it's not as stressful. So, there are a lot of applications of, compounding that I'll put a little bit more meters back over here that, are just, it's more than just, what you can just go pull off a shelf and put together. So, again, with pharmacy, it's, our roots are thousands of years old, and, we continue to use it with a little bit more modern tools, but, it's basically the same, the same stuff as from years ago. So with this cream, again, you can just apply a little bit to your wrists, when you're feeling a little stressed or you want to relax, and just inhale. If you feel like you want to have a little bit more, if you want it to have a little bit stronger smell, you can add a few more drops. And, it's important, can you have me a little thing? Yes, that as with any pharmaceutical, that you label it so you know what's in there, right? And so, make sure that it's labeled. With the little dropper, that is essential oil. There are other things that you can use it for. You can look it up on the internet, but, a couple of things you can do is when you take a shower, just put a couple of drops of it in your shower, just in the bottom of your shower, and it'll get a nice little aroma going and relaxation. So there's all kinds of good stuff. I see people putting stuff together. Has anybody finished with their job?
The ones that have their camera on, can you show the camera? We'd like to take pictures.
I like to
for
see
social media.
Do I have anybody that has theirs kind of done? Well, I see people working on it.
Yeah, I see people working on it. So Janet, I want to thank both you and Farah for presenting to the students today. And while they're finishing up their compound cream, I know that they'll be thanking you as well. And it's actually time for our next session. So